So this is to educate today about the congenital defect. A congenital defect is a defect which is acquired, which is from the at the time of the birth only, and this is a defect in the heart at the atria level. This is the right atria and this is the left atria. So between the atria level there is a partition wall known as interatrial septum. When the wall is having a defect, a hole, there is a defect known as a ASD, atrial septal defect. It is a hole in the heart at the atrial level. So what happens during life, as the child grows, the blood from the left side of the heart through that hole goes to the right side of the heart, and from the right side, from the right atria to the right ventricle into the pulmonary vasculature. So the blood flow into the pulmonary vasculature becomes increases as the child grows on, and the left to right shunt keep on increasing as the life goes on, and in that process child is having recurrent chest infections, upper respiratory infections, and he gets the respiratory tract infections for 4 to 5 times in a year, and the mother and the parents of the children are seeking the advice for multiple recurrent chest infection. So this type of the hole having a murmur which is very difficult to pick up in the early phases is to be suspected and properly diagnosed, and the hemodynamics is like that. Whenever there is a hole defect between the left atria and the right atria, the blood is shunted from the left to right side, and because of this shunt it goes on increasing and lot of blood is flowing to the pulmonary artery. The pulmonary artery pressures the lung, the pulmonary artery vessel pressures goes on increasing, and it comes to a stage of suprasystemic, more than the systemic. If the systemic is having 120 by 80 pressure, this becomes more than that, and after that there is a there is the shunt which is there at the atrial level from the left to right side becomes reverse, that is known as reversal of the shunt from the right to the left, and the child goes to sickness in the form of cyanosis, clubbing, and so many manifestations of the symptoms and signs, which is known as a Eisen-Majorization syndrome, or a reversal of the shunt, in which the surgical treatment or the closure of the defect for this thing is not possible. So the point of education is to the treating physicians and treating doctors in the periphery. Whenever they encounter this type of the defect, it should be immediately referred to a higher center where the surgery or the intervention is possible, and one should try to close this defect. This hole in the heart should be closed between the left and right side of the heart, so that the heart becomes near normal. So the defect is to be closed as soon as possible. Even in the childhood the surgery is possible and it's being done. The more early the surgery is done, the more better the result, and if the properly done in a very early stage, this life, it is very much compatible with the whole life, and this disease, the child and later on the grown individual will have a full fruitful life till the end of the life, and he have a normal expectancy. No much medicines are required in post-operative period in the life after the surgery, and no much regulations are required for this thing. It's a very simple defect to be treated, but provided this child or the adult should be referred to a treating surgeon or a physician at a proper time. So there are so many ways to close this defect. So as you can see, if I open the heart like this defect is between the left atria and the right atria. That hole here is absent. So we have to close this hole. So there is a way of closing the hole without doing any operation. So what we do, we pass in a guide wire from the femoral vein, and it goes and comes, enters the right atria, from where it goes through the hole into the left atria, and a device like thing is deployed there, and which goes in the defect, and it opens like an umbrella, and it shuts off the left to right shunt, and the septum is closed, and the thing will be taken care of. If it is not possible by intervention like procedure like this, the surgical help is sorted out, and during the surgery what is done, the heart is put on the cardiopulmonary bypass. So this is the aorta in which cannula is put. These are two vena cava, superior vena cava and inferior vena cava. So blood is drained, and it goes through the heart lung machine, and the heart is stopped for a duration of some time, maybe 10-15 minutes or 20 minutes, and the right atria here is opened from here to here, and the defect is exposed. the defect, that hole is there in the septum which is never is to be closed directly. So we form some sort of patch. The most common patch material which is used in the patient's own autologous pericardium, which is just fashioned in the shape of the defect and put it there, or we can use a synthetic material. So various approaches to the heart is there. While we have to close this defect, we can go from a median sternotomy. We just split open the sternum and enter the heart and repair the defect and close it. In certain patients who are cosmetically worried, or in particularly young females, unmarried, they don't want the scar in the front of the chest. So this operation can be opted on the right side in the form of mini thoracotomy. But in good centers, this operation is very easily done with a minimal invasive approach, with a very keyhole approach or a periaortic incision, or it can be tackled robotically. So the immediate postoperative care is not a big issue in this type of defects, and if the disease is well tackled properly in a proper time, the recovery is almost 100%. And we have to advise these patients to come as soon as possible to the hospital, and there is no age limit when the patient has to come. Patient has to come as soon as possible, so that the changes in the various chamber and then the pulmonary vasculature is not happen over a period of time, and the defect is closed. The more soon the defect is closed, the better prognosis, longevity, and the quality of the life. So all the treating physicians who are treating this disease in the peripheral hospital, in the district hospital, should refer the patients for atrial septal defect to a higher center where the surgery or the intervention is done, and this defect is very easily done, easily tackled, and the longevity and the prognosis of this atrial septal defect is very, very good. This is the only idea of presenting this atrial septal defect. So it should not be ignored, and it should be closed, and there is no medicine made in this world who can close this defect with medicines. Any form of intervention, whether it is a cath lab intervention in the form of M+ device or a surgical intervention, is required to close this defect. Once closed, the life of the patient is as normal as the other human beings. Thank you very much. That's the only message.